This is a human skull. As you can see, the calvarium is already separated. Now first let's start to demonstrate the parts of the human skull. Uh, there are some foramens. These are very important and asked often and all. Here are I have tried to make just a mnemonic, like the mnemonic is Jol Ross. J for jugular foramen. Now this is the jugular foramen. Here it is. O for optic canal. Here you can see this is the optic canal, this one, and L for foramen lacerum. How do I remember what structure passes through foramen lacerum? From the neck, the internal carotid arteries straight come upward, and as this is the most vertical and somehow at the middle point of the skull, so internal carotid artery enters skull through this foramen, and there are three foramens at the same line. These are Ross: foramen rotundum, foramen ovale, and foramen spinosum. This is foramen rotundum, foramen ovale, and foramen spinosum. Now, this large foramen at the base of the skull, this is known as foramen magnum. Now, let us start which structure passes through which foramen. First comes jugular foramen, cranial nerve 9, 10, and 11, glossopharyngeal, vagus, and spinal, and both accessory nerves passes through the jugular foramen. Next, the internal jugular vein also passes through this foramen and inferior petrosal sinus. Now, optic canal. There are two main structures, optic nerve and ophthalmic artery. In case of foramen lacerum, most important structure is internal carotid artery. Also there is greater petrosal nerve, branch of facial nerve. Now, foramen rotundum. In foramen rotundum, there are one structures only, maxillary nerve. How do I remember through which foramen maxillary nerve enters and through which foramen mandibular nerve? If I see at the back side, this is the foramen rotundum. Now this foramen, here you can see this foramen comes at the front side. So as the maxilla is little bit upward, it comes out from here and supplies here, and at somehow back the mandibular nerve comes from here and supplies here, like that. So the first structure which comes, it is the foramen rotundum. Through this maxillary nerve enters or leaves somehow. Now the structures passing through the foramen ovale, male structure, mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. And through foramen spinosum, main structure, middle meningeal artery or vein, emissary vein, and nervi spinosum. Now, middle meningeal artery is very much important from forensic point of view, because this artery bleed causes the subdural hemorrhage. Now, let us discuss how do I understand the age and sex from the skull. For age determination from the skull, we use two parameters. One is the mnemonic is SD. S for suture and D for dentition. Now, here you can see this is the coronal suture, this is the sagittal suture, and this is the lambdoid suture. We have to remember that the sagittal suture posterior fuses at three parts: posterior, then anterior, then last middle. Posterior part fuses between age 30 to 40 years, anterior part 40 to 50 years, and the middle part 50 to 60 years. Now, if we see for coronal suture, the lower one and half, lower half fuses first at the age 40 to 50 years, and the upper half fuses between the age 50 to 60 years, and the lambdoid suture upper half fuses between the age 40 to 50 years, and the lower half 50 to 60 years, like that. And then if we say for dentition, here the dentition is not visible, but you can say that if 32 teeth are present, then person is of course more than age 25, or at least 22. Okay, and if not, then we have to calculate the number of teeth and give the age accordingly, but most of the time you would find that the number of teeth is 32. Okay, then sex determination. For sex determination, we see first from the protuberance. In female, the here is the frontal eminence, and here is the parietal eminence. These are more prominent in case of male and female, and in case of female, the forehead is also straight, matlab ki vertical, and in case of male, here is the supraorbital ridge, this is round, and nasion is more prominent in case of male, and there is one also feature that you can find the orbit. It is not clearly understandable, but you can say after back calculation that in male the orbit is square and in female it is round. Thank you.